So my name's Deanna Najera. I've been a PA since 2006, however many years that is. Graduated from Chatham University in Pittsburgh. So I started in family practice, then I transitioned to urgent care. And now I kind of have a very unique spot in that I work in the emergency department part-time, county health department part-time, and I also do some psych on the side. So no week is the same, but it also gives me a lot of different experiences. I've also been involved at the state and national level in leadership capacities. So, met a lot of people in a lot of different environments, had a lot of jobs. So transitioning between jobs is something that I'm unfortunately familiar with, but hopefully you can kind of learn from some of the stumbling blocks I've hit, and this can be a useful presentation for you. That is my email. Please don't hesitate. As I always say, I won't look at your rashes or moles, but I'm happy to provide any other information that I can and make any connections that I can for you. So we're going to cover just some real basic stuff and kind of tips and tricks as we go through, and then plenty of time at the end for questions. So really, what are we talking about? So people will always say, send me your CV. Well, is that the resume? What is the difference? What does it do? So the cover letter sells you. That is your only in. That should be very personalized and show you a little bit better versus a resume or CV, which is, very regimented. Even in a format setting is pretty regimented. A resume in general should be 1 to 2 pages, no more than 2, because then it's too long. So the resume is the ADHD version. Quick and to the point, get your point across, and you really cut out a lot of things. So you might say, jobs of the last 5 years, or, last 5 presentations or something like that. You don't give your full list. Whereas your CV, which is Latin for curriculum vitae, it's your life's body of work. And so that's where you keep a running list of sort of everything that you've done. And it's kind of, the cover letter plus the CV, think of it like your personal statement. You really want to invite a conversation. You don't want to give all the details of who you are. You want to sort of set the stage where they're like, who is this person? I want to learn more about them and kind of get involved, and they want to invite you in or have a phone call with you. So that cover letter may be or maybe not the same as a cover email, since so many things are virtual. Half the time you don't even meet recruiters. You're just applying blindly into some system bucket and hoping that it makes a dent. So really think of any interaction you have counts as a cover email. So be polite. It's just like when you talk to a program, administrator or unit secretary or something like that. You never know who they know or who they actually are. So be very polite. And obviously, if it's written, it's going to live forever. So don't be snarky in it. But at the same time, advocate for yourself. You don't need to highlight that you're a new grad. The way I always think of it is you have diverse clinical experiences, right? Even though you've only been in PA school for your rotations, what you did before PA school counts as patient care experience. And there's ways we can talk about how you can kind of mold that to sort of bolster your application. And you really want to focus on the skills that you do have so that you're eager to learn. All of you are computer savvy, you're team players, you're excited to be taught new ways of approaching things, as opposed to saying like, I'm really sorry, I don't have experience. No apologies necessary. A lot of times, particularly in subspecialties, they like hiring new grads because they want to train you the way that they want you to work. They don't necessarily want you coming in with bad habits from others. So there's ways that you can kind of sell that in your presentation. So that CV and resume, we're going to use those terms kind of interchangeably because the basics of it are still going to be there. Obviously, you need your name at the top and an email. Make sure it's a professional email. You don't want it to say hotstuff69@hotmail or something like that. You want it to be a professional email. As far as using your school-based email, sometimes those emails will stop functioning once you graduate. So I really recommend that you use a personal email that will follow you forever, or at least will follow you for an extended period of time. Because if you're using your school-based email, sometimes those transition to like alumni.school.edu, and you can lose things in spam folders. And also the firewalls tend to be a little bit more stringent. So using like a Gmail or Yahoo or AOL or whatever it is that you have, as long as it's professional, is totally fine. And then a preferred phone number, it can be your cell phone, it can be your home phone. If you want, Google Voice can give you a new routing number. This is sometimes useful, especially if you're applying out of state or have a different area code than the place that you're applying. But honestly, nowadays, half the docs I work with graduated or went to school out of state, and all of our phones are different. So it doesn't have as much of an impact as it used to have. Having said that, I don't really recommend putting your address on your CV or resume for two reasons. One is that you never know where these things go. You know, it used to be you handed a piece of paper copy to the person you were interviewing with, and that's all the further that it went. But now that you're submitting it potentially to a recruiter who's going to blast it or put it into, you know, a public system, it can be anywhere. The other thing is that sometimes systems will shy away from individuals who are out of state just because they think it's going to take longer to onboard, or they feel like you maybe don't have connections to stay within the community. So if you're applying to something further away, I really also would not put your home address. So name, cell phone, and email is perfectly fine for the top of that. I do also recommend that you make it a PDF for two reasons. One is because it eliminates somebody accidentally or purposefully editing your CV. The other thing is that because of formatting. So there's beautiful templates for CVs and resumes out there. And I always look at them, I'm like, oh, that looks so pretty. And then I start to type in it and the editing gets all wonky. So mine is just a very straightforward Word document, but I change it into a PDF. If you use some of those templates, when you change them to PDFs, sometimes the spacing gets off and it doesn't look as nice. So make sure that you've sort of proofread it both as a Word document and as a PDF before you upload it. So generally, what you're always going to start with is an objective. The objective doesn't always have to be there, and we'll chat about that next. But you're going to start with your education, then your work experience, then any kind of certifications or licensures that you have, memberships and leadership experience, publications and presentations. Now, other than leading with education and work experience, the rest of those can kind of go in any order that you like, and also grouping together. So some people split out memberships and leadership. Publications are different than presentations, and really that's dependent on how many items you have under each header. So if you have one item, combine it with another header, and it just will look a little bit neater for you to do that. You want to keep the same tense throughout. This is called parallelism. So you did. So I did do this, or I do this. Really, and traditionally, it's you did. So I did serve on, even if this is your current employer, I did serve. So serve on the XYZ committee, served on the XYZ, you know, those sorts of things. And you really want to use short clip statements, which is called gapping. So managed multiple projects, supervised off-site clinic days, served on XYZ committee, and then you can put the years with that committee if it was different than the time that you were with that job. Again, you don't want to waste time and space by doing complete sentences. And also, you don't want to give too many details because you want to encourage them to ask you questions. So manage multiple projects. Of what? Well, what kind of projects did you manage? How many people did you manage? You know, those kind of things are like, huh, this is somebody that has different skills under their belt and might be somebody I want to talk to more about that. So what about that objective or goal at the top of your CV or resume? So this is kind of a few sentences to sort of say what you're looking for. So consider it like a tweet about your cover letter, a really condensed version of what you're looking for. And you're going to really make this personable. So this is where you can get tripped up, is that you have like, you're applying to a lot of different subspecialties. And so suddenly your objective says searching for a neurosurgical job and you're applying for a plastics job. And they're going to just toss it because if you can't pay attention to that detail, they're not interested in you. So sometimes it pays to be more generic. You know, if you're applying to all surgical jobs, just keep it as a generic applying to surgical or seeking employment in a surgical or subsurgical setting. And other times it pays to have different resumes for different positions, especially if they're very disparate. So if you have a surgery job and a family practice job, the layout of your resume may be entirely different. And so it can be helpful to have different resumes. Trying to advance here. There we go. So you can highlight some of your skills within that objective, or some, again, your passions. So desiring employment in a family practice setting with a comprehensive approach to patient care. You know, a really nice sentence that just sort of distills down what you're looking for. You know, and this includes objectives like applying to serve on a board of directors position or applying to serve in a volunteer capacity. You can have it for a lot of different reasons. This is a different one. So adaptable individual. So once you become a PA, you're an adaptable PA, but until you get your certification, you're an adaptable individual. So this is, again, you don't have to target that you're a new grad, but you can still kind of plug in those sorts of things. So with additional clinical experience in trauma medicine, seeking a general surgery position, that makes you stand out. So they're not expecting that you did a residency in trauma medicine, but if you did a second elective or your general surgery rotation actually covered a trauma unit, that gives you a different skill set that's really going to help you stand out from other peers that may be applying for that position. So I wanted to give you a couple examples, and these are from different health professions. Thank you, internet, because you can just type in like medical new grad, you know, and kind of get an idea of verbiage that people are using. So this is a nurse practitioner. Now, this is a case in point, newly graduated NP with 2 years of experience. Well, how do they have 2 years of experience? Now, I'm guessing that this is as a nurse or that they were doing it as they were completing their NP degree, but it seems like it doesn't match. And so it gives you pause and makes that resume not kind of rise to the top of the pile. So this is another one. So passion for supporting healthcare needs through empathetic patient service, a strong talent for cultivating, maintaining relationships, partnering with physicians, nursing staff, administrative teams. It's a really nice, written objective. But at the same time, it's sort of like, well, some of those things are expected. That's what you're supposed to do is partner with the medical team, so do you need to say some of those things? Not always. Now, I picked this one because I kind of like that it's really dedicated to a specific hospital setting that they're applying to at a strong community hospital like Robert Wood Johnson, and that is an uber, specific one. But if this is a place you really want to work on, you may want to make your objective really tied to that specific organization. Now, this other one is interesting. So this is a physician, and it says resourceful and compassionate entry-level physician, code word new grad, highly familiar with the diagnosis and treatment of multiple disease states. I'm going to pause for that because that's what you do as a physician. So this is where your objective just kind of seems like fluff because, yeah, you're supposed to be familiar with diagnosis and treatment of multiple disease and health concerns. So that doesn't need to be there. And if anything, it just makes me question, why did they put that? Why didn't they have other things to talk about? And the rest of their stuff is, I think, really good. Personable leader that excels in high stress environments is nice. And then they also have this thing about fluency in different languages. And we're going to talk about the pros and cons of including that and how to write those sorts of things out. Now, because we're keeping this modern and to the point, I typed into PT, excuse me, how do I write an objective for a new grad physician assistant? And this is what it came up with. It's actually really good. The problem is now, if recruiters start to see this, they're going to start being like, why is everybody writing these exact same words? So I have a feeling that you're going to start seeing some of these kind of catchphrases on resume builders and stuff because people are looking for help. This doesn't mean that you can't use some of these statements or some of these collections of words, but I would just be really cautious. Don't cut and paste from the internet because it's really easy to find out sources for those sorts of things.
Can I
So
add something?
Yep.
Because I was going to ask if you've used that at all, but I actually, when I was applying for jobs, I used that's hard to say, Chat GPT, or another one's called Cactus, and I had it just to try to see if it could write an email as a follow-up email, and then I took that and changed some stuff around. I was like, this is actually really helpful because I have anxiety, and so I'm sitting stressed about what do I write in this email?
Yeah.
And it was actually helpful just to get a template.
And that's exactly it. You said that perfectly, is give you a starting point, but definitely change it. Even if it's just using a thesaurus and changing every third word to something that means the same thing, just don't cut and paste. But absolutely use it as a way to say, how can I word this a little bit differently? Or I'm trying to figure out a phrase for this. Absolutely. But remember the whole thing with GPT, is that you can copy paste and put it back in and it will admit that it wrote that. And so that's what they're using for, people in academics right now, is figuring out if you actually wrote an article or an email or whatever, including speech writing and stuff like that too. But it can be helpful to give you a jumping off point. Great point. Okay. So education and work experiences, that both are going to be done the same way. If you're starting your with most recent first and working your way back. So you're starting with PA school and you absolutely want to put the anticipated date of graduation. And you can just write it just like that. So PA school attended, it's going to be, JB University in XYZ city, anticipated date of graduation, August 2023 or August 2024 or whenever. And you can definitely do that. You do want to mention any capstone or thesis projects that you have. And again, you can put pending or, in process or something like that. Depending on how you have structured your resume, or if you're doing the CV, you can absolutely put a sentence or two, again, very short and to the point, of capstone project entitled whatever, with a focus on, or something like that, that again, you want them to have a conversation about it. You don't want to give away all of your information, but you want to show if that's something that's important to you or something that you want to brag about, put some lines about that as well. You do not need your GPA. So I really just want to stress that. What do we say? The last person in medical school is still called doctor. It's the same thing in PA school. And a lot of the PA schools are pass fail. So you can't have a 0 GPA. So just don't put your GPA. For college, for PA school, for high school, none of that stuff. You don't need it. Nobody really cares. And I think if anything, if it's a low GPA, it just talks against you, but it was high enough for you to get into PA school and to graduate PA school. So don't put it on there. And really, you should stop listing high school at this point. After your first professional job, unless it was something super fancy or something very unique, there's no need to put that anymore, because the rest of your accolades will start to stack up. You do want to list some big things related to your school, whether that's college, any other professional schools that you attended, or PA school. So if you have student society, president of class, my thing is with that is always, did you actually do anything in the role? Because sometimes, when you have these class elections, it's like the first month of class and they're like, who wants to be treasurer? And somebody raises their hand and then they have no idea what they're doing about it. And then they just kind of graduate with that. If you weren't actively involved with the role, don't bother putting it, because what's going to end up happening is they're going to ask you about it. And if you have nothing to talk about, it's going to look like fluff. It's going to look poorly upon you. Or if you over embellish, $10 says they know somebody at your program, and they're going to find out if that's really true or not. So really only put things that are meaningful or that you did something with. And this goes with volunteer roles as well. So a lot of PA programs incorporate some sort of volunteer activity within your schooling. And even if it's something like, oh, we did 5 hours a month, throughout school, if it didn't really mean something for you, something that you can really kind of talk about passionately, I wouldn't list it, because it doesn't really necessarily bring a lot to your CV or bring a lot to you in the interview if they ask you about it. All right, so clinical rotations. The clinical rotations, I think, is always interesting how students kind of like try to put so much information in with their rotations. And I hate to always discount, like, yeah, you learn a lot and you do a lot, but nobody cares. Like it's understood that you're going to be doing certain things within certain rotations. So you really need to be expanding out the things that make you unique, or things that really stuck with you. So you can have, this is your PA school, and then you can have clinical rotations, and you can have a header that says like all rotations approximately 5 weeks in length, or clinical rotations between August 2022 and July 2023. And then they just sort of figure out that all of them are going to be about equal length. And that's plenty. You don't have to go into minutia. So how do you actually list that, especially as your first job? Because it is important, because they often want to know where you went, what other health systems you worked in. So you're going to list the rotation type, a practice name, a hospital, and a location. So if it was general surgery with ABC Surgical Associates, you don't have to put your specific preceptor. A lot of times it is better to put the practice that you're with, unless it's like a standalone doc practice, then you'll put, Dr. Smith ABC or some LLC or something like that. Otherwise, you just use the practice name is fine. And then what hospital they're associated with, if you rounded in the hospital, if it was just an office setting, you're just going to stick with the office name, and then a city and state location. And you're going to actually put these not in order of the time that you did them, but the order in relevancy to the job that you're applying with. Because I think that's something that I don't know where that gets left off as far as explaining to you. That's what makes the most sense. So if you're applying to a surgery job, you start with your surgery rotation, then an orthopedic rotation, emergency medicine, any hospital-based rotations. Whereas if you're applying to pediatrics, you're starting with peds, family practice, internal medicine, psychiatry, and then you're ending with surgery, because the pediatrician doesn't care as much that you did a surgical rotation, whereas the surgery rotation really wants to know what other sort of intensive either OR experience you had or other things like that. So you don't have to put them in time order, you're putting them in the order of relevancy. You do want to indicate if any are electives, or if you have pending rotations. So especially if you're in this in-between where you're starting to apply to jobs, but you have future rotations scheduled, you put, rotations completed, and then you just have a space and say pending rotations or rotations to be completed, and you list those with the presumed location that you're supposed to be. And then if they're an elective, you want to indicate that, because that says, I was actually really interested in this. This wasn't part of my standard rotation, because not all the docs recognize what our standard rotations are. So I would kind of pull those out and indicate like elective rotation in burn, or elective rotation in NICU at what such and such hospital, something along those lines. Some programs do have a longer, what they call a preceptorship or an internship, that is like 8 or 12 weeks versus the standard rotation of 4 to 5 weeks. So again, you want to pull that out and either have a separate header or a little bullet point underneath that say like, this was a longer preceptorship, or this was a longer clinical experience, just to show that those are different than all the other rotations that you named. And I do have some more information about this. I also really like to mention whether electronic health records or electronic medical records you are used, because that means a lot as a new hire being like, oh, they've already used a Cerner? Oh, awesome. So their onboarding is going to be that much faster if they already have like the basics of the EMR down. You can have that as a separate standalone line of all the EMRs listed, or list it tied to each one of your rotations. That's a personal choice, but I kind of like having that. If you're doing a one-page resume, again, it can be something you can just say experience with multiple EMRs, and then know the names of the EMRs that you've used. Again, it sort of is bad when you give the wrong name in an interview setting. So I would write them down and keep them just for your personal reference, in a longer CV setting versus just on the resume. But that can, again, be helpful for those new jobs. Now, as I said, you can list some clinical experiences that you gain as a summary, like applicable skills or under specific rotations, but everybody assumes that you can already do an H&P, you can already do basic laceration repair. It actually detracts from you when you say, like, I've done 15 sutures, because it doesn't seem like that much. Even when you write, I've done 40, to somebody that's been practicing in the field, it just seems like even less. And you're like, oh, that's it? Oh, even though we were students, that's probably all we did too, but it's hard for us to remember that. Whereas I do probably, 10 to 20 a month. So I really don't recommend listing those sorts of like exact numbers of how many a procedure that you did. I think it's fine to list things that are important, assisted on a Whipple, assisted in the several C-sections, assisted in C-sections and live births, different things like that can really make you stand out. But also within those rotations, things that are different than normal. So for example, my general surgery was actually cardiothoracic surgery. And there's reasons was that I wanted an extra emergency medicine rotation and an extra rural medicine rotation. So I said, stick me whenever surgery you want. I don't want to do surgery. So for me though, if I would have ended up applying to a surgery job, that would have been something that would have stood out to me. My surgical rotation was cardiovascular surgery involving CABG procedures, including endovascular vein harvesting, so that's where I would expand that detail out, versus just saying like, I watched them do, a gallbladder removal or something like that. So you really want to tease out those things that make you stand out from the crowd. And then after you get your first job, you're really going to remove your rotation experience. This is why I always tell people, keep a CV forever, like just put it in an archived file or something like that, because maybe it'll be fun to talk about at one point in time, like, oh, I think I went to that hospital, or how's so-and-so. But in general, you don't need to have the rotations. The only exception to that is unfortunately, if you end up leaving a job within the first year, 18 months after you graduate and you're applying to a new job, you may want to have the rotations if you're applying to an entirely different specialty, just to sort of prove that you still have some applicable experience. But after a few years, nobody cares about that anymore. So I stole this. That is the link, and I will have all these slides available for you guys to have. You can email me, or we'll post them somewhere. But this is just how they sort of stacked that. And again, the clinical experiences, they just listed the year that they were doing their rotations. They put the specialty, the clinic that it was associated with, and then the location. Very neat, very clean, very to the point. But again, I would change the order of that based on the job that you're applying to. Now, what I like is they also talked about framing for experience. So this one here, the one that's on your left, is the clinical experience. So they're talking about direct experience. So if you're applying to a dermatology job and you did a dermatology rotation, you're going to tease out. And you notice here, they didn't say, I did 6 punches, I did 12 excisions. No, just gained experience. That's it. And they said exactly what they did that for. And then the indirect experience. So if they didn't do a dermatology rotation, but they're applying to dermatology, they put in, ideas that they had related to that. Now, see, in dermatology, I would list, pediatrics is rashes all day long. So I would have put that rotation up higher. Same thing with internal medicine, I would have put higher. Emergency medicine, I would have put a little higher because you're suturing, so you can see how you would phrase that or flip that to match better with the job that you're applying for. All right, so work history. For now, it's absolutely appropriate for you to list any jobs that you had before PA school. A summer internship, I think it's still applicable because especially if it's something that you had a couple summers in a row, like you were a camp counselor for 4 years, I would absolutely include that because it shows continuity. It shows that you stuck with it. But really, again, it's all about selling yourself. So I always joke that, I think bartenders are the perfect applicants to PA school because why? You recognize alcoholism. You recognize when people need help. You know how to cut people off. You have de-escalation techniques. You're basically a therapist behind the bar for everybody that comes there. But it's all about how you sell that. You handle multiple competing priorities. You're a skilled customer service representative. Those are those what we call soft skills that actually apply to the medicine world, even though you're not necessarily prescribing medications or treating complaints, but it still shows that you can work in a high stress environment. So I think the work history is still important in that regard. You do want to explain significant gaps in your resume. You don't have to necessarily list why. You can also address them in the cover letter or just wait until the interview. And this can be if you had, a mental health issue or a physical health issue, or you had a kid, and you took a, planned career break to focus on family or personal health events. I will tell you that once you are a licensed PA, anytime you apply for a state license or hospital privileges, they require a separate letter to explain any gap in your work of longer than 3 months, because it's considered like, well, what were you doing that you weren't working in the medical field for that period of time? That changes state to state and health system to health system, but just be prepared for that. It doesn't have to be in depth. There's some things as far as legality of questions that they can ask, but you should be able to explain some of that, but don't feel obligated to give a life history, and violate your own privacy for those kind of questions. So with licenses and certifications, again, this is another header that you're going to have. So for your board exams, you're going to have anticipated exam date. Nobody outside of the PA world knows what a PANCE or a PANRE is. So you're just going to see board certification or NCCPA board certification. For state licenses, once you start that application process, you can say pending, because we know depending on the state that you're in, that can take weeks to months. But it's the important thing is that you've gotten that paperwork together and you've submitted it. Your DEA license, you're just going to want to say what state you're licensed in. Remember that your DEA is per state. So even if your clinic has satellite offices in 2 different states, you need 2 different state licenses and 2 different DEA licenses. And then also your BLS, your ACLS, any PALS, ATLS, any other acronyms for any certifications that you have. This includes like if you have wound care, mental health first aid, anything that has ongoing certification, this is the place to list it. And also your certificate of added qualifications. So if you decide to get those in the different subspecialties, this would be a place to list it as under your advanced boarding. I have seen a couple of times where people put their license numbers on your CV and resume, and I just want to tell you, you do not have to do that. So every single state has the ability to look up your state license. So I can go to any state and type in, Board of Medicine, Utah, and then type in license verification, and you can get a pop-up screen that you can verify that. Same thing with NCCPA, you can verify a license very easily. The biggest thing is you never, ever, 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 ever want to list your DEA license on your CV. Especially if you already have your email and your phone number and your address. That's a good way to get your license number stolen, and just don't do it. They will ask for it and you will submit it directly to the hospital system or whoever's credentialing you. You do not need to have that on your CV. You can simply just list that you have your DEA. So on my CV, it says, NCCPA board certified since 2006 through 2024. I have state licenses, and then I have it listed Maryland since 2010, Pennsylvania since 2006, DC since 2022. And then under DEA, I say DEA licensed in the following states, and I just list the states. I don't have any of my license numbers actually on my CV. And just because we need even more acronyms in our lives, the other thing that you're going to get is what's called an NPI, a National Provider Identifier, is I think what it stands for. So basically, this was an idea that, and part of it came out of people that were job jumping between states to sort of flee bad case outcomes. So you would lose your license in Pennsylvania and you'd go get a new license in New Jersey, and you would lie on your application because your applications say, did you ever lose your license in any other state for any other reason? And you just say no. The states don't always double check. So the NPI was a way to sort of get around that without having a federal license. It's just a license, it's just an identifier. It doesn't allow you to take care of anybody. It doesn't allow you the ability to prescribe prescribe medicine, but it's your unique identifier. It follows you wherever you go. And it's also put on prescriptions, often depending on the states, not always, but they'll sometimes say NPI number. You can apply for that once you have your board certification, or your first employer will apply for that. But it's a number that you need to sort of either have memorized or keep on hand. It is something that is very easily looked up. You just type in NPI lookup, you type in the person's name, it'll pop up. Again, because it doesn't allow you to do anything. There's also this program, it's from the Council of Affordable Quality Healthcare. It's called a CAQH ProView is now their name for it. And it's basically a clearinghouse. So it's used by more private practices or smaller practices as opposed to health systems. But basically you upload all of this information because you put your licenses, where you work at, and then you start getting insurance registration numbers and other things that I have no control over. But this way you give your password basically to your admin person, your credentialing person, and they can go in and find all this stuff out and update it for you. Again, it's something that's useful, not required on our end, but it does help you to kind of keep track of all this nonsense that's out there. Your Medicare, Medicaid provider number and insurance registration numbers, so I have a Blue Cross number and an Aetna number, and this state, I don't know any of those. I'm sure I have them. They're in my CAQH profile. And that's actually monitored by my employer at one of my jobs. But it's not something that I really have to keep an eye on. But it is something that when they bill under my name doesn't mean anything. They bill under a specific number. All right, so then another header that you're going to have is your professional associations. So you do want to list organizations that you're part of as a student. So a student member of the Maryland Academy of PAs, or you're an associate member of, cardiovascular surgery, whatever, something like that. Feel free to list those. I will tell you, now go ahead and join those organizations because it's cheaper as a student. So if you know you're going to go practice in another state, or you want to practice in a certain specialty, go ahead and join before you graduate and your membership fees go up. Once you're a practicing PA, you're going to remove those organizations that you were a student member of unless you held a position. So for example, I'm still a fellow member of the Pennsylvania Society of PAs, and I was a previous student director at large, but really I just say fellow membership of all of the organizations that I'm a part of. And you want to put the organizations as PA Society or Maryland Academy of PAs, not physician assistant, because of title change. And we want to try and limit confusion as much as possible. So just use the abbreviation, American Academy of PAs. Technically, it's the American Academy of Physician Associates, but people are going to get real confused when you're Maryland Academy of Physician Assistants, and then you're physician associates, and then it's the National Commission certification on PAs. Just simplify it, make your life easy, just put PA Society until everybody's on the same page. All right, so I'm going to say this because you got to do it. You should always join 3 organizations: your state, your specialty, and your national organization. Just join, put it on auto renewal, and do it for the rest of your career. These are the people that are advocating for you. And the reason I say that you have to join these 3 is because on the state level, there are state rules as far as what you can prescribe, what kind of jobs you can do, different things like that only your state can impact. Then there's your specialty, which is representing you to the medicine societies that are the same. They also clue you into certain billing things that are specific to your specialty. And of course, your national organization is what's arguing for you on the federal level as far as federal laws. So, federal things say this, but the states can always say this. That's why you have to join those 2 organizations at least. And then the specialty is always helpful, again, specific to the job that you're doing and sort of advocating for you. So just, put the money aside, put it on your credit card, auto renewal, always stay a member. But then, of course, if you have lots of money and you want to join some other things, don't forget about the SIGs and the caucuses. So the SIGs are the special interest groups. So these are things that are sometimes specific to different patient populations. So Society of PAs in Addiction Medicine, or specific, PA moms is a SIG. And then there's the caucuses. So the African Heritage Caucus, the LGBT Caucus, the PAs for Latino Health is a caucus. So those are more personal identity sort of things. And all of them are happy to take new members. They need people to volunteer. So if there's certain things you're passionate about or certain things that you identify with, check out the list. So I think there's 127 constituents constituent organizations, or COs. So COs are all the states, all the specialties, all the SIGs, and all the caucuses. And that's where these all fall into. So, this is something that, again, lots of different ways for you to get involved and lots of different ways for you to have identities. I think I'm a member of like maybe 10 different organizations. Some of them are free, some of them cost money of varying amounts, but it's something that's important to me because I think, my dollar bucks help support them doing the work on my behalf. I volunteer with them when I can, but even if I can't, paying my dues helps them advocate for things that I can do. So a next header is awards. Again, really focusing just on college and later, unless you had some really significant award in high school. And I hate to tell you that National Honor Society is not a significant award. Even valedictorian of your high school class, when you're this far out and you start to get more awards, you're really not going to care about that sort of thing. But if there's something really, pretty significant, then I would absolutely list it. I wouldn't leave it off. With awards, you can put them under the umbrella of either your education or your job, especially if you've gotten, 2 awards, in your career. But as you get more awards, because all of you will, then it can have its own category where you start to list them. So publications, posters, and presentations, this is that same thing that when you start and you don't have a lot, you're going to put them all together. And you're going to have them just as that is a single line, and then you're going to list them. And as you get more in each category, you break them apart. So case in point, publications and posters for mine is a combined heading, and then presentations is a separate heading on my CV, because I only have about 7 publications and posters, but I have a lot more presentations. So it just made sense for me to split them so that you can see them. And again, they're in reverse order, most recent first. Now, sometimes what you can see, oh, I heard a chime. Is there a question?
That was me.
Okay.
If what you did was like a publication that was an undergraduate project that has nothing to do with the PA profession or even really medicine, would you suggest leaving that out?
No, absolutely keep it in. Just put it under your schooling, unless it was a presentation, like you gave at a conference or something like that, and you have a couple other ones. So I was on a research team when I was in college, is on my summer breaks, and I had 2 publications. There was like 30 authors, and I was one of 30 authors. I left those on because they're still part of your professional development. But I would just put it either under your education or a separate header. But yeah, absolutely can still keep those sorts of things.
Okay, thank you.
And do make sure that it's the same format. So depending on your background, if you were in social work or counseling, you might use APA formatting. If you were in the literary world, you use different ones. But unfortunately, since you are now a medical professional, you're going to use AMA formatting. The nice thing is PubMed makes it really easy. So if it is an official presentation, official publication, you can ask to cite and then change the format to AMA. And just copy and paste, make your life easy. I will say that as time has gone on, I actually include links. If it's publicly available, I'll include the link in my CV so they can get to it directly. But that's only if the full article is posted. If it's just an abstract, I figure that they were really interested, they can Google it themselves. All right, extracurriculars. Really, my thing with that is it important to you? Is it part of your identity? And does it look good? If it's one or both of those, then go ahead and put it on there. If it's neither of those, then don't bother. If it's something you're not that passionate about, I wouldn't put it on there. Or if you're like, yeah, I did it, but then don't, because they're going to want to have a conversation about it. And if it doesn't come across well, then there's no point in putting it. So specific to this group, so DEI involvement, it can be part of your educational experiences, things that you did, part of your professional organizations or your employer. So case in point, I serve in we call it the EI&D committee within our hospital system. And so I have that listed. I have, employed at ABC Hospital, and then I have a bullet underneath it that says currently serving on the XYZ, EI&D committee since 2022. Or it can be under this separate leadership activity header. It's really dependent on what you feel comfortable with. So the next side, I'm going to warn you, is very busy on purpose. Basically, what I did is I went through and sort of Googled, DEI resume and sort of pulled a couple of different things so that you can see there's a lot of things that fall under that umbrella. When we talk about DEI from a medical world, we're talking about like health disparities, and we're talking about diversifying the profession. But that could include a lot of things like outreach and mentorship programs, even putting together like outreach initiatives, community service projects. And those, I think, again, if it's something you're really passionate about, something you can talk about, then I would absolutely put that either tied to your job or tied to your education. So these are just some examples, and you can see where it runs the gamut from everything from just coordinating activities to running like budget initiatives, looking at key metrics to improve programs, planning and organizing outreach efforts, looking on a request for proposals, developed and taught a multicultural film series. That's not medical at all, but that's pretty awesome that you did something like that and you can talk about it passionately. It really will come across well. So these are just some like verbiage, and you see that they're all sort of short clip statements that are sort of like, well, what did you do with that? You don't have to go into a lot of details, but you want to sort of have those action verbs of how much you are involved in those different things. So we're going to switch gears a little bit and talk about a whole bunch of other things. So language is spoken. So there's a lot of talk about how you put this in a way that sort of helps you and doesn't hurt you, especially if English is your second language. Unfortunately, we live in a biased society. And so if you have a very foreign sounding name, that can be a mark against you. And so you want to make sure that you can say that you are fluent in English if you feel like that's necessary, or if you speak a second language, you want to make sure that that comes across well. So one of the ways is saying native fluency or native proficiency. And you should indicate if it is all three, or if it's not, is really important, because you can say, you can speak a language very well, but you can't read it or write it, is not necessarily a knock against you, but you don't want them assuming things that aren't true. So native fluency is one way to put that. I do also want to stress that even if you were born in another country and speak the language 110% fluently, that does not actually make you certified to speak in a medical setting in that language. And this includes American Sign Language, ASL. And so there is a medical certification, becoming a medically certified interpreter in whatever that language is. It actually protects you in malpractice cases. So I'll give you a case in point. We had a physician who was bilingual. She spoke English and Spanish. She learned Spanish later in her life. She was not born speaking Spanish. She communicated to the patient in Spanish. They had an okay outcome, but then came back the next day and they used an interpreter for her the second visit because that provider did not speak Spanish. And the patient had had a complication. And so it was brought up in front of our quality and safety committee because they said, oh, well, you didn't use an interpreter the first time and you're not a certified medical, a certified medical interpreter. You're not certified to speak both languages. So you could have lost something in interpretation that could have influenced her health outcomes. And she's like, okay, well, then that's fine. I'll just stop speaking Spanish to my patients. She's like, then we'll wait for an interpreter or we'll pay more for the language line to do this. Now, in an emergency situation, using some of that to get through like the basics of, are you allergic to something? Are you pregnant? Do you have chest pain? You're going to do the Spanish that you can to get by. But when it comes to like medical legal protections, you really want to have that certification. Now, the nice thing is a lot of those certifications are kind of a one and done sort of thing, or they last for, 5-10 years. But if you are bilingual, it is definitely something that I would consider doing to protect yourself and also looks good to employers. If you were raised internationally, you don't have to necessarily put on your CV, country of origin or where you were born, but based on your schooling, it may be obvious that you were not raised in the United States. Again, just needing to sort of highlight that you are English speaking. Obviously, you made it through PA school, but sometimes you have to really hone in on that. So highlighting things that you did with English speaking organizations can really be important. And you may need to indicate residency status depending on the job. So this is one of those sort of gray zones where they can't ask if you're allowed to work in a country, but they can kind of get around. They need to know, if you need to have employment in order to keep a visa or something like that. So it's a gray zone, but you need to protect yourself, but also know what your rights are when it comes to those sorts of things. As far as references, oh, yep, go right ahead.
Sorry, Deanna. So when you say know your rights about being an international student, can you elaborate more on that?
Sure. So like I said, there are illegal questions that employers are not allowed to ask you, that you're protected against from discrimination laws. So, and I actually have a slide about this, but it's absolutely fine to talk about it right now. So basically they can't say, oh, are you married? And how many kids do you have? Are you going to have kids? Just like they can't ask you, like, were you born in this country? You know, do you, are you disabled? You know, what they can't ask those specific questions because it's considered illegal, and then you can actually sue them for that. At the same time, though, you are not allowed to sort of, especially when we start talking about licensures and doing different things like that, you have to be very careful with regard to your ability to stay in the country. And then sometimes like the controlled substances and things like that, you obviously you have to have you have to live in the United States. You have to have an address in the United States in order to get like your DEA license and things like that too. You know, some of the, as far as like the visas and the green cards and all of those kinds of things, knowing what your employment status is, you know, sometimes attending PA school, you know, and having education, you have to suddenly leave the country once you finish that if you don't have employment within a certain amount of time, or if your employer doesn't write a letter on your behalf stating that you're, you know, an integral part of the organization and you need to stay. So your employer sort of deserves to know that you're going to be asking that of them. I do not pretend to know all of the ins and outs of those sorts of things. So I would definitely, a lot of times talking to your school, the larger schools that have a larger international student population, they have somebody that specializes in that or can at least speak to that a little bit better. Or if you're talking to any immigration lawyer, they can talk to you a little bit about that more as well. There are some free services as far as immigration law is concerned, and you can type in like free immigration legal advice just to kind of get the ball rolling, or talk to a consulate or embassy from your country of origin, and they can give you some more information about that too. But it's a gray zone as far as, you know, demanding information from you, but you also having to be upfront as far as what you need in order to stay in the country. Or because the last thing you want to have happen for either of you is that you go through all this process of getting hired and then suddenly you have to leave the country because of, you know, immigration concerns. So just kind of keeping that in mind. That wasn't really a great answer, but I hope it kind of brought up at least directions that you can go.
Thank you. Yes.
Certainly. Okay, so for references, do not list the person's name and contact information on your resume. That's not fair to your references. And we would hope that anybody that's applying to a job has references. So a single line on the very bottom that just says references available on request is completely fine. You don't have to have anything more detailed than that. Now, what I will actually tell you, this is a tip and trick that I learned the hard way, unfortunately, is ask preceptors for letters of reference while you're on rotation. And I'll tell you exactly why, is that I had an emergency medicine rotation, and one of the docs that I worked with, he was fantastic. And he's like, if you need a letter of reference, you let me know. Like, you're doing a great job. I'd be happy to write it for you. And I was like, awesome. And so then 4 months later, I go to graduate and I email him and say, hey, you know, Dr. Smith, you told me you'd write a letter. And he was like, yep. And then he sent me a copy of the letter and it was like, this student did a great job. I would endorse them for their work. Like, it was the most generic letter ever because he couldn't remember who I was. And I didn't fault that for him because they had 10 students at any one time rotating through. It was a large trauma department, you know, and it had been 4 months, but it really taught me the importance of like asking for that letter while you're on rotation. You know, in our day and age, they're going to save the letter somewhere on their computer. They can, and I tell them, you can put it in an envelope, you know, do the whole sign across the back and you just keep it. And then if they're like, you know, I don't have a copy of that letter, be like, I'll mail it back to you so that you can look at what you wrote. But you really want to make sure that they're writing specifically for you. And I tell you, go ahead and ask every single preceptor if you feel like they would give you a good letter. Just like it's a letter of reference when you were applying to PA school, you want to make sure it's going to be a quality letter. It's not the same letter. It ticks me off when somebody says, well, you write the letter and I'll sign it. Then you don't want the letter from them, because if they're not going to put the effort into it, that's not somebody that you want advocating for you either. So just skip them. But anybody else, like you feel like you had a really good connection. Now, obviously it says a lot if it's the chair of the department or lead PA or whatever, but if it's, I'd rather you have a good quality letter from somebody that you worked with versus somebody with a lot of letters after their name. So go for the person that's going to write you the better letter or be the better reference for you. Keep in mind that the vast majority of larger health systems now have electronic references. So, you go, you interview, they ask for your references, email address, and then on the receiving end, I'll get an email that says, Jane Smith is requesting a reference. Click here. And I click a little link, and it'll be some check boxes like, are they, can they talk? Can they document? Or do they have good morals? Would you have them take care of your family member? Any comments? Yes or no? Excuse me. And that's it. Like, it's so easy, but it also is pretty benign. So a lot of times what will happen is then the actual hiring physician will then actually call your reference at a later date. So you do want to make sure that your reference knows that you're applying to a job. Make sure they know what specialty you're applying to, because it's really bad when they're like, oh, I always knew they'd be in emergency medicine. And the person's like, well, they're applying to a surgery job. So make sure that they know that's what's happening so that you can kind of set them up for success too. So I do want to talk about resume bias. So it is a very real thing. Its studies have been around for decades that have shown that this is a true thing. And so the original studies, they had the exact same resume. The only thing they changed was the name on the top of the resume. And they had a traditional Black sounding name versus a white sounding name. And those findings found that it didn't even matter the person hiring for the job. And this is where we talk about implicit bias and unconscious bias. And we can have a whole conversation about that, of course, that they preferentially would hire the person with the white sounding name over the person with a Black sounding name. Further studies have shown that female names versus male names, and all minorities, not just Black, but other minority names, tend to be hired less likely for STEM jobs. And medicine is considered a STEM job or a science technology job. So, this is something to be aware of, that this absolutely can happen. So you can put a nickname or initials on your CV. This is entirely your choice. Don't feel obligated to do it. I do think that, especially in medicine, because we have so many individuals who come from diverse backgrounds, it's not as big of a thing as it may be in some other fields. The only time that you really have to be careful with this is as long as your human resources, your onboarding paperwork, and your license match. You can't use initials on your license. It has to be your full name. And so you just have to make sure that it matches. So if you go by a nickname, you go by a middle name, that's entirely fine to put that on the top of your CV. But you don't want to lie about it, because the last thing you want is for them to call your name and you're like, I'm sorry, what did you say? And you're like, well, but that's the nickname you put on your CV, and then that's not your name. So you want it to match, but you can absolutely use initials. Sometimes people will include pronunciation spelling of at least their first name. So they'll spell out they'll just write out the pronunciation or put in parentheses how it's pronounced. That's up to you. That's not a requirement, but it may be something that you feel comfortable with. It's not necessarily a pro or a con. It's just something to consider. All right, some interview stuff. So finding a job, depending on the specialty, depending on the area that you're applying for, it can be hard. I always tell people is that there is a balance between, you're not going to come out making $125,000 a year, but nor should you come out expecting to make $35,000 a year. But if you're working in the middle of nowhere, Iowa, you may not be making $100,000, so you have to kind of keep that realization in the front of your mind. Sometimes you do have to cold call practices. If they advertise for a nurse practitioner, I think it's fair game to go ahead and put your application in. Keep in mind that you often have an administrator that is going through resumes and they're like, oh, not an NP, not an NP, not an NP, or new grad, and they just throw it in the trash can. So sometimes you do have to follow up with a call or an email, preferably directly to someone versus recruiter@healthsystem.com. You really have to talk to somebody specifically to sell yourself and have a really good elevator pitch for that. And I will say, sometimes you have to take that less desirable job. You've got bills to pay, you got loan payments coming up. But if you do take it, try and stick it out for at least a year. It just looks better on your resume. But at the same time, don't stay in a position that's toxic or that you feel like is putting your license at risk. I'm half embarrassed that I have a job that I was at for less than 6 months. I took a job in family practice for just about 4 years. I went to an urgent care job and I was like, oh my God, I need out. And so I was only there for 6 months, but now buried in the rest of my CV, nobody really notices. But it is something that is just, sometimes you have to leave and it's the right thing to do to protect your license. I'm a huge fan of always carrying business cards. Get personal ones without any company ties, because the last thing you want to do is be handing out a company card to somebody else that you're trying to jump ship with, you know? So my CV or my personal business cards just say my name, my email, and my phone number. It doesn't have anything else on it, but it has blank space. And so I'll write, a little message like, we talked about a surgery job, or we talked about this opportunity, and then I'll hand them the card so that they have that with them. They do have, the really nice virtual cards now where you can have your own QR code. You can put it on the back of your phone case. But some of the older docs, aren't really great on technology. So the paper business cards still go a really long way. And you really just network, because, it really helps when you have that personal connection. I'll give you a perfect example. So we're hiring within our health system in the emergency department, and we do hire new grads. But there was one particular new grad that I met at an AAPA event, and she said that she was applying. And so I connected with the person and I said, hey, I can vouch for this new grad. I've worked with her. She's a go-getter. I can't say anything about her clinical skills, but the fact that she showed up on her own time at an advocacy event as a student, I think that's pretty, hot dog awesome. So I would endorse her, and at least got her to the interview stage. I'm not putting anything of mine on the line, but I'm at least advocating for somebody else. And that's why networking is so important. You never know who you're going to kind of meet and greet at any of these kind of events. So questions to ask. I think this is a really nice question. And this was offered to me as a way to say, like, basically, why do you have high turnover? Like, are you losing PAs left and right? Like, so why is this position available? They're like, oh, Jim was with us 20 years and he finally retired. That says a lot more than, well, this is a high stress environment and people don't always know what they're getting into. Oh, no. So that means people just get in here for a year and then leave. Why are all these people leaving? And then again, sometimes you just need a job, and so you have to take it no matter what. Ask if they've worked with PAs before, because it is a different skill set. It's different onboarding than working with nurse practitioners or new attendings. And ask if they've worked with only experienced PAs or have they worked with people that are fresh out of school. Ask about their onboarding process. So onboarding is basically that new hire process. So I'll give you an example. When I started, I changed from one emergency department system to another emergency department system, and I got 3 shadow shifts. So it means 3 shifts where I was working with the other PA and then I was on my own. Now, part of that was because I'd been a PA for 10 years. The other part of it is because I actually already knew the electronic health record. So I didn't need that much onboarding time, but that was the expectation is 3 shifts and you're good to go. Now, when I was new to emergency medicine, it was a 4-month onboarding process where basically meant I was an extra body for every single shift. The whole point was for me to soak up as much knowledge as possible. And you have to ask those expectations and get it in writing, because sometimes they'll say, oh, we let our new grads, when they come into the office, we start them with a half schedule for the first 2 months. And then the second week that you're there, you suddenly have 20 people on your schedule. That's inappropriate. You need time to learn. You need time to collaborate with your attending physician, talk about what's kind of going on, work through cases, make sure that you're really sort of cementing the knowledge that you have from PA school. So you really want to have that in writing of what those expectations are. And you want to make sure that you've met the docs that you're actually going to be working with, if at all possible, especially as a new grad. If they're hiring for an office system, sometimes you're just interviewing with a chief. You're not actually interviewing with the people that you're going to be working with day in and day out. And that's really important for you to know them and see if you're a good fit. The other thing is not just talking about the immediate thing, but ongoing things. So, if you're in a surgery practice, like the cardiovascular surgery PAs do the endovascular vein harvesting. So asking about, well, who pays for that training? When do you expect me to do that training? In emergency medicine, when you're a new hire in our health system, they expect you to get your CAQ in emergency medicine within 2 years of hiring. But they set that up for you. They have grand rounds every month. They put aside time. They pay for your certification. So they built that into the onboarding process. So knowing those sorts of things are important. But it also says to you on the interview process, it says about you in the interview process, hey, this is somebody that's not just looking to get a paycheck. They're looking to advance themselves. And how can we sort of help support that? Now, as I mentioned, certain questions are not legally allowed to be asked, but they can still be assessed. So are you authorized to work in the United States? That way they can get around, or are you married, or do you have kids? Are you able to work overtime or pick up shifts on short notice? it is still a boys' world. And so for women, when they start, they often want to know, because we're a lot of times younger women coming out of PA school, like, oh, are you going to be here and then start popping out babies and then drop back to part-time? And I'm going to basically pay this money to have you come on, and then I'm going to lose you as an employee. And so they'll ask, like, do you have kids? Are you married? Sometimes it is just in general because they're curious and they're having small talk, but they're not technically allowed to ask those sorts of questions. American with Disabilities Acts apply. So there is a balance if you need any kind of accommodations, like if you have back problems or leg problems, or you can't, do work in certain situations. But you can also phrase it as a point of success. Like, I was able to do really well in my surgery rotation because they gave me a stool to sit on for longer cases, or, I took breaks out or something along those lines. And there are some links there that talk about some of those illegal questions and ways to work around it. And again, I'll have the slides available for you guys to look at. All right, some contract stuff. You always want something in writing, it gives you some protection. It's always kind of shady when, as a medical professional, that you only have to give 2 weeks notice. Most places it's a minimum of 1 month notice, because you're not a nurse, you're not a medical assistant. It takes a lot for credentialing and paperwork and stuff to go through. It takes a lot to bring somebody new on. So you really want to make sure that you have something in writing that talks about notice, talks about non-compete clauses, talks about all those insurance issues. You want to know about benefits, health insurance for you, you're in a family, how much is covered by your employer. Family leave is rarely paid in the medical world. That is changing. More and more practices are starting to do that, but often it's at a cost. So you can get paid paid family leave, but then you owe them an extra year after any time taken off or something along those lines. You also need to know who's paying your licensing fees. So state license fees range from all over the place, from $50 to $200. Your DEA license is almost $900. Hospital privileges can also come with a cost, and you want it in writing of who's responsible for that, where that money is coming from. So sometimes they'll say, well, you have $2,000 of CME budget for a year, and you're thinking, okay, that's pretty good. Well, if you combine that with a flight, a hotel, and conference registration fees, that'll maybe cover one annual conference somewhere or one state conference somewhere. But what if you have to pay for your DEA license that year, or your state license is up for renewal? What if you have to have uniforms, like they all want you in scrubs with embroidery? That's going to eat at that, or they want certain lab coats. Sometimes there's surgical equipment like the eye loops, the eye magnifiers, they want you to pay for that. Those kind of things, like whose budget is that coming out of? But also memberships. We talked about your state, your specialty, and your national organization. So, I've had a variety of different places that have covered some to all to none of it. And it's in a lot of different ways. So like one of my employers said, we'll cover one membership a year, and I got to pick which one it was. So what I did is I picked one of the ones that had a 2-year membership, and I just alternated my years back and forth, because the physician memberships are often $500. The PA ones are $250 or less. So they didn't notice that it was anything different. But it was a way that I could then pay for both my state and my national organizations every year and not have it come out of my own pocket. So what about malpractice coverage? You absolutely need this in writing. You need it in writing, and you need proof of it. So as soon as you're employed, whoever is onboarding you, say, hey, can I just get a copy of my malpractice coverage? And you keep it forever. Scan it in, email it to yourself, print off a paper copy, put it in a lockbox next to your license, and keep it forever, because every single employer is going to ask for proof for every year going forward. So there's 2 main types of malpractice: occurrence versus claims made. So the occurrence means is whatever happens during the time you are under the policy, you're covered for the rest of your life, whatever those statute of limitations may be. And the statute of limitations change based on the age of the person that's injured, the type of injury, and the state that you're in. So there's a lot of variability with that. Versus a claims made says you're only covered while you're under that policy. And so when you're a claims made, then you need what's called tail coverage. So tail coverage basically means more claims made coverage, usually for whatever the statute of limitations is, which is usually 3 years. And so your employer should hopefully pay for you to have tail coverage after you leave that employment, but you want that again in writing, and you want proof of coverage. So you need to know that going in, so that you already know what you need to do when you leave a job potentially. You do want to consider getting your own coverage. That's something to think about. I've carried my own malpractice ever since I left a very shady job a number of years ago. And the type of coverage that I have is claims made, and it's capped. So every year it went up by a little bit, but now I've been capped at the same amount for the last 7 years. So applying for new, because I even shopped around to see if I could get a cheaper deal, but now it's actually cheaper for me to stay with the same company. So it does cost me almost $5,000 a year. I do write it off on my taxes. I could potentially use my CME budget against it, but it's something that I think is important to me given the kind of work that I do, given that I have multiple jobs, that just gives me better coverage. All right, contract stuff. Contracts can be anywhere from 1 page to 25 pages, and I've had all of those. It needs to include some basic stuff. So what is your base pay and how is that determined? So some have, and this is where your onboarding is important, is that some will say you have a base pay that's, this high for your first 6 months. And then your base pay actually goes down because they're expecting your productivity to go up. And then half of your salary is productivity based and half of your salary is a base salary. Other ones are entirely productivity based. Other ones are just a base salary. And it doesn't matter what your productivity is. But then there's also bonus structures. And if there isn't bonus structure, you want to have a conversation about that. So sometimes that's based on your individual productivity. Sometimes that's practice productivity. And sometimes it's a combination thereof. So one of the employers that I have is a little bit of everything. So there's my own personal productivity. There's the amount that the practice made in. And then they also have what's called an engagement bonus. So meaning as long as I'm involved in different things, I can get additional money just by saying like, hey, I serve on AAPA or my state society or whatever. So you kind of want to look at all these different options and sort of figure out what's the best fit for you. You want to look at how they determine number of hours, especially if you're salaried. Is it included? Is it expected that you'll be on call once a week? What does that mean? Does it mean just taking first call, meaning, the ER calls the orthopedic practice and says somebody has a broken hip? Or is it you actually coming in for surgeries? Is it for you answering questions? Do you get paid if you come in? What does that look like? And then if you pick up extra shifts or you start to work extra weekends or extra evenings, do you get paid a difference for that? What about holiday coverage? The hospital sleeps for no one, so we're always open. What does that mean for you and your quality of life, and what does that look like? There's also shift differential. I have a night shift differential because I work night shifts. Some people are weekend only option. There's a whole bunch of different options with regards to that. Other things to look at, a signing bonus or relocation expenses. It looks really nice to get $2,500, but a lot of times you have to pay it back if you leave early, and sometimes that's with interest. So even though $2,500 may be huge if you're having to move out of state or something like that, but there's that possibility that you have to pay it back, so that may not make it worth it. You also want to look at how often the contracts are reviewed. Is this an annual auto renewal thing? Is this a 6 months and we'll have a conversation? You want to look if their standing of living increases, length of time that you've been a PA, length of time you've been with a specific company, if there's caps on income. So sometimes what will happen is that every year you go up by a certain amount and then you cap, but you get a bigger percentage of any productivity that the practice brings in. There's 7,000 different options with that. So I would strongly encourage you to make friends with somebody that has some contract negotiation skills. But I always tell people everything in the contract is negotiable. Now, sometimes it means giving something up to get something else, but there's always a way that you can kind of work around certain things. All right, so when you're actually transitioning to practice, what does this kind of look like? Pass your boards. Just focus on passing your boards. Get that done, right? Then you're going to apply for your state license. And as soon as you have that application started, you can often start the hospital credentialing process and the insurance company credentialing process. Every practice has a credentialing person. How good that person is extremely variable. There's I take that back. I'm sure there's some kind of certification to become an official credentialer, but I don't know about it. And I don't feel like, having interacted with a lot of people who do credentialing, I don't think there's anything really out there. So I feel bad for them because it is a hell of a process, but at the same time, it's their job. So you really have to sometimes stay on them. And that's why I said keep copies of everything. Like I have so many folders saved on my computer of, these are all my old licenses. This is proof of my vaccinations, because sometimes they want proof of your last flu vaccine or COVID vaccine and all these other things. This is my malpractice. This is my employer. This is who my license was under, all of those things. You have to have your state license number before you can get your DEA license number. And then in a handful of states, you also have to get what's called a CDS license, which is a controlled dangerous substance license. So like I said, it is a hassle. So in Pennsylvania, there's 2 boards of medicine. There's the Board of Medicine and the Board of Osteopathic Medicine, and then a DEA, but there's no CDS. In Maryland, there's only 1 Board of Medicine, but I have to get a DEA and a CDS license. Every state is different. And so if you're going to do telemedicine, good luck. Get an Excel spreadsheet going so that you can keep track of all of these things and when things are due and all that sort of stuff, because it does take an awful lot of work. So how do you get involved? How do you kind of get involved in the hospital, in the practice? Sort of how do you get used to everything? Just show up. Oftentimes just showing up, being engaged is really all that you have to do. And then just keep showing up. There's so many people that are listed as members of a committee that don't even come to committee meetings. And even if a lot of the hospital committees don't technically allow PAs and NPs, they're physician-only committees. If you just sit in the room and you're sort of like, I'm just here to listen and learn, or they start saying like, well, this PA screwed up. And you're like, actually, as a PA, I can tell you that that's not actually how that works. Or actually, PAs are trained how to do that. It sounds like this was actually a doc error. It makes a difference. So what do you got to do? You got to speak up and you got to keep speaking up. And that honestly will open so many doors for you if you just keep doing that. It can be exhausting. And that's why it's really important that you have a mentor and or a sponsor. And there is a difference between a mentor and a sponsor. So a mentor is somebody that kind of talks you through things and supports you. It's a safe place to vent, whereas a sponsor is actually creating opportunities for you. So I've had bosses that have done both well and have done both very poorly, where they're saying, hey, I heard about this opportunity and I thought about you. And then I think it's really important as us as PAs, because there are much fewer opportunities for us, is that if you have a position and you're leaving it, you bring another PA into it, because otherwise it's going to be filled by an NP or a doc, or the position's going to disappear. So if you're going to volunteer for a committee and then you're like, you know what, I have this other opportunity, but I recommend PA Smith or PA Jones take this position in my place, that goes a long way to continuing that mentorship and sponsorship. So the other thing, especially when you're first starting out, is keeping your own list. Just at the end of the day, keep a list of the number of patients that you see, number of procedures that you're performing, so that if you listen to the billing and coding talks, that's called RVUs, which are your relative value units. So basically the complexity of the patients that you're seeing, any critical care that you give. You should be able to get a printed report from your practice manager on a monthly basis, and you should be able to compare those numbers. They may not match exactly, but they should be in the same ballpark. So if they're completely different, it means that you're getting lost under the physician billing. And what happens is then it looks like you're costing the practice money. So this is particularly true in surgical practices where you're doing like post-op care, because post-op is part of the bundled pay. So basically it means that the insurance company gives the practice $5,000 to do a hip replacement. And that includes a pre-op, the procedure, and post-op visits. If you're only seeing post-op patients, you're not billing anything because it's all being included under that. So what you argue though, is you say, yeah, I do all the post-op visits so that the physician can see 10 more new patients for every 10 post-op patients that I see, and bills 10 visits that otherwise you wouldn't have been able to bill. And that's how you can argue that you're bringing in the practice money. And you can also trend this over time, especially as a new grad. So basically, I have an Excel sheet and I say my patients per hour, my RVUs per hour, my critical care per month. And I have it on a monthly basis. And I just have a little graph. And so I just keep the graph myself. And then when I go in for my annual review, I just make sure that it matches the numbers that the doc has. And we just talk about it. I say, yeah, I'm continuing to be a top performer. Or, we changed and I changed how I started billing. And you can see that my critical care billing improved. Not that my care changed, my billing changed. So I'm bringing you in more money just because I'm doing a better job billing. And now I'm still one of your top earners, which means I think I should get some more time. Maybe you can't pay me more, but I want to have to shift off a month so that I can do something else. Yeah, question.
Hi, Deanna. I just have a question. I was wondering, is there any way you could, if you have like a blank of that spreadsheet that you use every month, would mind sharing it with our with the directors, just because I feel like that's such a useful thing.
Sure.
One of the preceptors actually was just talking about this because she back her RVUs, and it was like she was like performing at 13%. She's like, that makes no sense. I see like 35 patients a day. How is this happening? And we actually had a conversation about this. So I think this is definitely super, super useful that us in the organization, like we could use that as new grads.
So I will say I don't calculate my own RVUs, and this is a big thing about practice setting versus hospital setting. So in a hospital setting, they are determining what they're billing. So you just have to document and hope that your billing encoders actually do a good job. In an office setting, I'm circling my exact codes. So it's much easier to say how much I'm billing for. And so in that way, and I don't know how much you guys have had on billing and coding. So in an outpatient setting, I see 10 99214s, which is a level 4 established patient, and I see 10 99213s, which is a moderate complexity patient. It's a standard billing as far as how much RVUs you get per code. And so you can just multiply 10 times 2.5 or whatever the RVU thing is, and it'll transfer over to your total RVUs. And then you can just divide it out per month. So if you're in a hospital setting, though, purely hospital setting, it's much harder and you have to rely a lot more on just your own, what metrics they're giving back to you. So that's why I just write down number of critical cares. I'll just keep track of number of procedures. And then you should be able to ask whoever your billing department is, hey, can you just run me 1 month of de-identified? So meaning it doesn't have any patient information, but de-identified. And they'll say, oh, well, you saw 13 9921 whatevers, 14 of these, you did 7 LAC repairs, and all of those kinds of things. But I can absolutely show you, like, I legitimately just track down the reports that we get on a monthly basis and plot them out and make my own graphs. But I don't do the calculations themselves, if that makes sense. All right. So to that point, as boring as it is, take any and all reimbursement workshops that you can. So I'll never forget, I'm sure we had one when I was in PA school. I don't remember it at all. And then I started in family practice, and one of the other PAs pulled me aside and was like, listen, now that you know what insulin is and like how to use metformin, now we're going to talk about billing and coding. And he talked me through like review of systems and HPI, and you have to have so many of this, and this is this coding, and this is how you get this level, and this is why. And he talked me through my numbers, which made me much more aware of it and made me both a better biller, but also more valuable to my company. And then I also say keep a rolling document of the things you do throughout the year. You know, some of them make it to your official CV, some of them don't, but it's really important for that annual review. And that's part of in your contract. Do you have an annual review? What does that look like? So, you know, we sit down for the annual review, and I'll sit down with my chair, and she'll be like, hey, I know that you signed up for this hospital-wide committee. Is there anything else that you did that I wouldn't know about? And I'm like, well, actually, you know, I'm giving a talk to PA students, and I lectured at one of our programs, and I, you know, precepted on the side. And she's like, oh, you did a lot of stuff. And I'm like, yeah, you know, she's like, oh, that's okay. And it also helps her, because then they brag about it from a department standpoint. And again, then when I say like, I can't make that because I'm doing this other stuff, she's gonna be like, that's fine, because I know that you're doing something that's worthwhile, and it's important. I do say always keep your CV sort of updated and email it to yourself. You'll never guess the number of times that people have been like, hey, just shoot me your CV when you get a chance. And it's so nice to be able to be like, oh, let me just find that real quick and email it the same day, you know, strike while the iron is hot, and be like, hey, I know we chatted. This isn't entirely up to date, but this is pretty close to where I've been. And I date my CV. So I write on the top like CV, and I put like 01/2023. So people know when I last updated it. And I can say, I did a couple things since then, but this is the majority of my stuff. Love to chat more. And it just kind of, again, keeps that open line of communication and really works well, especially when you're hunting for new jobs. I did want to mention, just because there's the chance some of you will get married or divorced or other things and change names, the name change process when it comes to medicine, because why make it simple? So you're going to start with your Social Security, then your driver's license, then you change your state license, then you change your DEA. Once those are changed, then you can target your hospital system, your electronic medical record. You need to keep a copy of any marriage certificate or court documents for forever. I've been married 13 years, and I still, when I start a new job or they re-up me for something, like, by the way, do you have your marriage certificate? Yes, you know, here's a copy of it. Sometimes they need a paper copy, sometimes they'll accept a scanned copy. It just changes all the time, but it's something, again, just keep that document forever. But it is a bit of a hassle, and I'll still get things that are to the wrong name. It also sucks if you have multiple practices. None of the pharmacies, none of the insurance companies can handle if you have more than one job at a time. I constantly get stuff from the ER all the way faxed over to the health department and vice versa, and they just can't handle it. So be prepared for that nonsense as well. We talked about a lot of different things, and there are a crap ton of resources out there. I really recommend the AAPA Career Center. They have stuff about new grads, early career, changing jobs, all the information about contract negotiations. Obviously, go through the Huddle as well. There's a lot of resources if you just search the Huddle on things that are out there. There are job coaches and things like that available. I did also want to plug to this group specifically that there is a paid fellowship, fostering minorities as leaders in addiction. And this is, again, paid fellowship for individuals who identify from racial and ethnic minority populations. You have to be a PA student through June 2024. So some of this may not apply to some of you guys, which is a bummer. But it's basically gives you some additional education regarding addiction management that I would really encourage. So with that, I do want to, we have, half hour or more for questions. And of course you have my email address, and I'm happy to send copies of all of these slides. I'm going to end the show just so that I can see you all and see what kind of questions you guys have or thoughts that you have after that kind of brain dump of information.
Okay, so I have a question, and it might be just because I have like major anxiety when like going up to somebody. How would you say is the best way to approach somebody for a letter of recommendation? Like, let's say they are not like, oh, let me write you a letter of recommendation. How do you even bring that up without being like awkward?
Wear a t-shirt that says, do you like me? Check yes or no.
Okay, perfect. I'll do that.
No, so what I think is, if this is if it's in the process of a rotation, you're coming up towards the end of the rotation, as you can, sucking up is always good. So you say, I really appreciated this rotation. I don't know if we've had an opportunity to speak about it, but I'm really interested in whatever the field is that you're interested in, and simply say, I would really, I feel like a letter from you would be really helpful, but I totally recognize that you have a lot of demands on your time and I would not want to burden you in any way. Do you think that's something that you would feel comfortable or would feel possible doing? So it gives them the out, and the other thing, again, you should be able to tell based on your interactions with them of whether you think that they're going to take it seriously or whether, again, it's going to be a form letter that they just find replaced your name with somebody else's name. And don't ask, if it's not somebody that you feel like it's not any good, don't ask. Nursing supervisor letters are just as good as PA letters, and actually one of the docs that I used to work with, he said, whenever he hired somebody, he said, how would your charge nurse describe you? And then he said, and now can I call her? Because that was his thing, is he said, I want to know how you're going to interact with the people that actually run the show. And that's not me, that's the nursing staff. So, having a letter from a charge nurse, I think, is just as good as a PA or any other, somebody else that's significant in the department that you're in, practice manager or something like that too. Obviously, you're going to need a reference from somebody that can speak to your medical skills, not just a professor, but somebody that knows you clinically. But absolutely, just say, I recognize that this might be hard. If you feel comfortable, and then definitely sending them an email so they have your contact information. When I write my letters, I always request a copy of your CV to review so that I can speak to some of the things on your CV. And so that can be an offer from you. I'd be happy to send you my CV so that you can see the other rotations that I've done. If that would help you to feel more comfortable about this. Lots of outs. So does that help? Okay, cool.
I wanted to add something too to that. Deanna, everything you're saying, I'm sitting here these are all the things I wish I knew before I applied to jobs, because I will be starting a job and I've gone through this process, and I'm this is all the stuff that I had to figure out. So it's the most helpful information. But I wanted to add on with the references. It's such good advice to get them as you go and get a variety, PAs, doctors, nurses, whatever, because depending on the job you apply to, sometimes they require specific ones. I had jobs say we want 2 physicians, and then the third one could be a PA, or we want an academic one, a physician and a PA, or they can all be PAs, you know, whatever. So make sure it's like a variety. It's not just all PAs or all physicians.
And they will sometimes ask for professional versus peer. And to the point, they also will want a supervisor. So we know that we're usually pretty nice to our peers and our colleagues. So sometimes they do want a supervisor one. Sometimes supervisor is ill-defined, again, can be a nursing supervisor, but often they'll want, some of them will specifically say from a chair. Now, as a new grad, you can push back. You can always say, like, I never interacted with the chair of the department, so the only thing I can give you is the dean of my program, or, you know, something like that. Like, just because that's the header, sometimes you have to say, you know, sometimes the credentialing department doesn't know that you don't have access to some of those things, or you just say, is this sufficient? And then just make sure you tell your reference, hey, I checked with them. You only have 3 boxes to check from. This is the box that you're supposed to fit the best in. Other questions?
Deanna, I have 2 questions. So I recently came across one of the surgeons. She mentioned that they're not doing reference letters anymore, versus they will do a personal call. So in such a case, like, do you just put that in your resume CV that the surgeon is willing to do a personal call? Because the reasoning that she gave me was they won't know if you just wrote a letter and signed my name. So she said that nowadays we're only doing phone calls. So where would you put that they're willing to talk to them in person for our behalf? Would it go under the resume, cover letter? Like, where would you recommend it?
I would not put that in writing anywhere, because part of the interview process is there are very few jobs that will talk to your references before they talk to you. So what I have is actually a separate sheet that says my references available. And again, this depends on your health system. And so on my reference sheet, to the point that was raised, I have, you know, physician references and then peer/professional references, because I have some people that I've never worked with clinically, but can talk to my skill set doing outside of PA, you know, things, or, you know, other faculty members and things like that. And I would just put a notation, is you put their name and you just put their phone number. You don't put their email address, and you just write prefers phone contact, and you send that letter to them. So that's just a very simple way. You just have your reference list. And then the other thing is that some of them from the credentialing department, they'll say, fill in their information so that they can contact them. And they always ask for a phone and an email, and you just leave the email blank. And then they'll reach out to them by phone. And then you just include in the email to the HR person or whoever, just say, FYI, Dr. So-and-so only will respond to phone messages, not to email. And it's that simple. You don't have to do any other deeper explanations.
Thank you. And another one is, I was recently made aware that, I mean, like, there's been a lot of fundraising on the war in Ukraine. So somebody mentioned that even though it was for a good cause, don't put it on your CV and resume, because you never know who the other person on the other side is. So would you recommend not putting any of those?
Yeah, and that's where the DEI can get tricky, to be totally honest. You know, yeah, you have to be very politically correct. And so that's why sometimes you'll put fundraiser for health-related organizations. You know what I mean? Keep it very generic. And if they ask, say, well, you know, there's, as you can understand, there's been some very tumultuous things in the world. And so we fundraised for various health-related organizations. You know, and if they ask really specific, because if they keep asking questions, it's probably because they're interested in it. And then you can give them more detail. My thing is also, it's a 50-50, because the other thing is, do you want to work for an organization that looks that negatively on things that you're passionate about? But you need a job, you know? So, you know, sometimes you have to take a job working in a place that you don't necessarily believe in, just to get the experience, pay the bills, and get the hell out. Like, if you have to do that, you have to do that. I would love to say that we could turn down anything that we didn't want to take, but sometimes you have to take those. Obviously, never work for an organization that puts your license, your livelihood, or your morals and ethics in peril in any way. But sometimes you can very much disagree with the individuals that you're working with. And you have to see, how does that translate to patient care? And so I'm a huge believer in not just doing the video calls, doing calls, interviews in person. And this is an argument I've made on an interviewer side, is who is the interview panel and who are we trying to recruit? You know, the people complain that we don't have diverse people, but then you have all white men interviewing the applicants. Like, what did you think was going to happen? If I can't see myself in this role, then it's not going to happen. But getting that into people's heads sometimes is extremely challenging for people that aren't really with it, as from a DEI perspective. And that's where you sort of have this thing of making change, being a change agent from the inside of the organization versus the outside of the organization. But as you walk through, listening to the chatter, you know, listening to what people are saying, how do they address other patients? You know, especially in the emergency department, we talk trash about patients all day long, but there are limits. You know, there are certain things that we just don't say. There are certain things that we just don't do. And that is different. That's a different culture in one ER to another ER. So what is that culture? How do you feel comfortable just being accepted for who you are, where you're working at? And what is that interview process? You know, when I was applying to PA school, at one place, they paid for my travel. They put me up in a hotel room. I interviewed with, you know, 3 different people, all the way down through the chief medical officer, the chief of internal medicine. They had me see a realtor. They wined and dined me. And then I met the director of the actual department. And he was like, yeah, I mean, sure, like, you got some good credentials. And I was like, this is the worst interview ever. Even though they did all this extra stuff, the guy I'd actually be working with was terrible. And thank God they actually were like, well, he's gone in a different direction. I was like, thank you. That good. Me too. Like, it was awful. But then I interviewed at a family practice that was a mom and pop shop, and it was awesome. It was exactly where I needed to be at the moment. You know, and so you have to feel comfortable from a variety of reasons in that specific spot. But if there's something that you're like, we just don't see eye to eye, then it's probably not going to be the job for you. But great question. Yeah. Other ones. LinkedIn profile. So I would say do the LinkedIn profile if it looks good. You know, if it's bare bones and you don't have a lot there, you know, and you got to think, like, who's actually going to the LinkedIn profiles? The recruiters absolutely do. So make friends with all the recruiters. That's not a problem on LinkedIn. You can definitely find some jobs that way. I've gotten cold called for jobs through LinkedIn. I'm like, I'm not looking for a job. And they're like, yeah, but we really liked your CV. And I'm like, great. Sure. I'm trying not to be rude, but please stop bothering me. You know, but there's absolutely ways that you can make connections through that. Same thing of like, hey, I love the work that you're doing. Who do you work for? Or you're working in the city or the health system I'm going towards. Can you tell me a little bit about how it is working for them? But as far as putting it on your actual profile or your CV, probably not. You know, it still is kind of old school from an interview perspective, but you can guess that people are Googling you. So you want to make sure, just like applying to PA school, that your social media is still locked down. You know, there's no spring break photos floating around of you, or if they are, bury those things, you know, post some other stuff, write some articles so that they go to the top of your Google search. Set up a Google alert for your own name and image, because, you know, things get poached. But yeah, I think using your LinkedIn profile is one of those that is absolutely very professional. Hopefully will continue to be so, but I wouldn't necessarily use that as a marketing tool on your CV, because if your CV is getting to them, they already know who you are. It's more of another way to get your CV in the door. And I saw another hand raised. Is there another question?
Yeah, I was wondering if you could talk a little more about like how to respond to those like questions you're not supposed to ask, like illegal questions. Like,
Yeah.
Can you choose to actually answer them if you feel comfortable enough, or do you think
Sure.
they're always kind of like,
Yeah. Yeah. And that's, you know, especially because case in point. So when I interviewed out of PA school, I was single, unencumbered, you know, just needed a job. And I got pulled aside by the lady doc. It was a husband and wife duo. And I was the same age as their son, who was in PA school, you know, so she's like, I know I'm not supposed to say this, but, you know, this is a small town and there's not a lot of available men here. And we'd love to have you, you know, and I mean, looking back, completely inappropriate. But if you met this woman, it was my mom, you know,
Yeah.
slide to just try and give me some, you know, world advice. And I took it as the compliment that it was, you know what I mean? And I told her, I was like, I want a job. I like what your practice does. I feel like I would fit here. And if it happens, it happens. Now, happenstance, I met my husband who lived like 3 blocks away in the same podunk town, you know, whatever.
Oh, wow.
You know, yeah. So it worked out really well for me.
Yeah.
That is, you know, how it goes. But looking back, like now, so then as I took another job and then it was, oh, you're married, do you have kids? And I was like, well, we don't have necessarily plans to, but I'm really interested in what this job can offer me. You know what I mean? Like just steer the conversation back around. You don't have to call them on and be like, I think that's an illegal question, because that's going to shut the conversation down. But you can absolutely sort of steer the conversation back of, I'm willing to do whatever it takes to be successful at this job. Like, it doesn't matter if I have 3 kids or I have no kids or whatever my life happenstance is. I'm happy to do overtime and work weekends. And, as you can tell from the fact that I was, did 24-hour call shifts when I was on the surgery service, point out other times that you went above and beyond, and I think that would speak just fine to some of those questions.
Okay.
It's up to you.
Yeah, I'm sure that like calling him out is not going to get you the job either. So it's like, okay, let's be tactful with this. So
yeah.
Thank you.
And one of those, and so in some of the links in there is like an article on how you can respond to some of those questions. Again, just sort of pivoting it around to like, are you authorized to work here? Is like, I can at this point. There's nothing encumbering my ability to get a license, and since I passed my boards, there's no reason that I can't continue to provide optimum, care to my patients. You know what I mean? You haven't really not answered it, but you've also focused it back on the fact that you have real world skills and you're eager to learn and you're going to do a bang up job.
Cool.
Yeah.
Thank you.
Absolutely. Yeah. Other questions?
Deanna, so is it common practice to work for free until you get credentialed for 4 to 6 months?
So you can't work. So keep that in mind, is that if you are not credentialed to be providing care, you cannot be providing care. Now, the way that some places get around that is they basically use you as a scribe. And there's pros and cons to that. So often some states have what they call a PAG or a graduate or pending license, where basically you work as a student without being a student. And so you can actually still see patients, but you can't sign charts, you can't write prescriptions, you can't order anything, but you can actually touch patients. That's state to state specific. But then other places will hire you as a medical scribe, and you can't touch them, you can't interact, you can't ask questions. All you can do is document in the chart, and that's it. But until you are licensed and credentialed with that hospital system, you cannot be taking care of patients. So sometimes people go back to whatever they were doing before PA school. So I worked with a PA who was a medical assistant before she went to PA school, and she kept her medical assistant license active, and she was a medical assistant for the 3 months before her credentialing packet went through. I've had a PA colleague who did DoorDash when he was furloughed, he started right when COVID hit. And so he did what he had to do to pay the bills. But yeah, you cannot work in a medical capacity, even volunteering, until you are licensed and credentialed somewhere.
So if some practice is asking you to work for free, that is not appropriate. Am I getting it?
Yeah, the idea is working for free is, what are you going to be doing for free? If you're answering phones, sure. But in which case they can pay you to be a receptionist. You know what I mean? Like it's always hard. There does have to be a line to saying like, you are worth something. You know what I mean? You are worth being paid something. And that's where you can say, are there other tasks that I can do unlicensed that I can still learn the flow of the department or learn the flow of your practice and still be an assistance? Doing prior authorizations. Nobody likes to do that. That's a great skill to have. Making appointments, restocking, are there other things that you don't need a license for? But I would not work for free like that. No, you got bills. Yeah.
And what's the duration from like interviewing for the job to like when you actually hear? Like as soon as it's like 3 or 4 days and you don't hear back, and it's
Sure.
like I get anxious, but then I hear everybody saying that, oh, it's not even been a week. So
Yeah.
How long?
Yeah. So the interview process to credentialing can take 6 months. So that's why I usually tell people when there's 3 to 4 months left in your rotations, start applying, or at least putting out feelers. Your position that you're applying for may not be available. And if you haven't already, don't lose your mind. It's okay. You've got plenty of time. But you can sometimes score a job just because the credentialing process can take so long. The tricky part is always that you have to have certain things in place before you can be put through credentialing. But nevertheless, so you interview for a job. Usually, you reach out to the recruiter and they say, hey, Chief Brown will interview you on Friday. You know, your interview lasts, then sometimes there's a second or a third interview, depending on what kind of practice you're in. And then what I always say is you need an email, but a written card goes a long way anymore. You know, it used to be, some of it's the time frame of you email back, thank you so much for this opportunity today. I really appreciate it. I look forward to hearing from your next step. But a handwritten card, oof, it is good stuff, because nobody gets written anything anymore. The tricky part is that the time it takes from you mailing something to making it inside a hospital department is easily 2 weeks. Now, if they're in a practice, sure, it can get there right away. Or if you can drop it off at the hospital, but like mailing it to Dr. Smith at ABC Hospital, you know, it goes, somebody opens it, they put it in a box, and then eventually it makes their way over. So that takes forever to do. But a handwritten note goes a long way, just thanking them for the experience. You're really looking forward to working with them, blah, blah, blah. Usually depending on who's doing the actual hiring, because if it's a recruiter, the recruiter is often in touch with you much quicker because they know that you're getting other calls from other places. And also remember, they get money based on you being hired. So they tend to be a lot more responsive. And that's who I usually will communicate with, is the recruiter, or practice managers. I'll say, hey, I had a great time meeting with Chief Brown. Let me know the next steps, and then send Chief Brown a written card or email and say, you know, I'm really looking forward to this. But it depends on when the other interviews are scheduled. If they do 1 day of interviews of 10 people, then they're going to make a decision within a week. But if they're interviewing over the period of 2 weeks, it's going to take a month before they get through everybody. And that's a good question to ask in the interview itself. Can you give me an estimated time for, notification and things like that? This is obviously my top choice, but I understand if you end up going in another direction, and I just need to know, from timing perspective of how this is going to look, or how does your process normally unfold? From the moment of the interview until the time that I can start, and that like, hey, because I'm going to start, right? You're going to hire me. How long do you usually take this process? And half the time the chief is like, I don't know. I say yes, and then you show up one day because they don't really know what actually happens. But then what ends up happening is they give you a contract. The contract usually has to be returned within a week to 10 days. Take your time to actually read over it, have somebody else read over it a third time. Then you sign it, get it back, then it's official. Then you have, assuming all of your state licenses and everything are already valid. If it's a hospital-based system, you have to be credentialed at that hospital. So then there's a separate credentialing packet with the hospital where they want proof of your vaccination. Sometimes you need a physical. Sometimes you need a drug screen. You usually need a PPD or tuberculosis test. You need fit tested. You have to fill everything out, and then you get credentialed by the hospital. The hospital credentialing committee only meets once a month. So if any part of your packet isn't complete, you get bumped until the next month. So this is where it can take you months and months and months. And so, for example, we hired a new graduate, and she said, her packet was complete. They put it forward, and the credentialing committee said, well, we don't have proof of her prior malpractice. Well, she was a student. She doesn't have malpractice. No, we want a letter from the school stating that she was covered under the school's malpractice while she was a rotating student. Okay, so she got bumped another month. You know what I mean? Like, sometimes it just depends who's working and what questions they ask. Or they don't like your references. Your reference checks the wrong box, and so they flag your thing, and it goes back through. Once you're through credentialing, assuming your license is through and your DEA is through, they have to build you into the hospital system, into the electronic health record. Usually that's as simple as them entering your name and hitting like go live. But I guarantee you the first day that you start, you won't be in the system, or your name will be spelled wrong, or you'll be listed as a nurse or an MA. So you're not going to be able to order things, yada, yada, blah. Then, since it's your first day, you have to do onboarding. So depending on your hospital practice, you have to do like a boot camp where they talk about like the privacy laws and occupational health things, and, our spirit values and our mission statement. And then they have like their electronic health record. Sometimes they don't do any of that, and you just show up at the front desk the first day and they walk you back to security and get your badge. There's a lot of variability in that. And part of that depends on who is your actual employer. Are you a hospital employee? Or are you like the surgeon's employee that just has privileges at the hospital? In the emergency department, we are actually a subcontracting group. We are contracted to work in the emergency department, so we don't have to do the hospital onboarding stuff, but we still have to know how to use the EMR and all those kinds of things. So that's why it takes forever to get actually started. And that's also why those contracts will often require 90-day notice to leave a job, because they expect that's how long it's going to take to bring somebody new on. I always argue 45 to 60 days is more reasonable for notification. Make sure that notification is both ways. They shouldn't be able to give you a 2-week notice that your position is being terminated when you have to give them a 90-day notice. And most of the time, if you just say, I want this to be both the same, they don't have a problem with that. Now, there is a with cause and without cause, which basically means like if you punch a patient, they're going to terminate you that day. But as far as like they just are downsizing, you want them to make sure that they have to give you pay or at least notification for a period of time to allow you to onboard somewhere else as well. So now that I've made you all just terrified and disappointed with your career choices, are there any other questions that you guys?
Thank you, Deanna.
Sure.
Yeah, I have like a pretty simple question and then maybe a little more complicated one. So you had talked about like interviews and stuff. And what are your thoughts on asking about getting like tours or coming in and shadowing for a day before you like accept a position or while you're going through the interview process?
Yep, absolutely. 110%. I think that's incredibly appropriate. You know, pre-COVID, your interview was always in person. You know what I mean? You had maybe a 10-minute phone call and then you came to the department and you did a meet and greet. Now, it may have only been with the chair, but they walked you around, they introduced you to whoever was working. But I've also interviewed at other jobs where you had like a full group interview. You met every single physician, because especially in smaller family practices, like they were all equally responsible for your work and they wanted to know who they were working with, you know, day in and day out. The emergency departments are more fluid, and it was sort of like 2 or 3 people would be on your interview, that sort of thing. I think it absolutely, you need a flavor, you need to kind of see, and you need to see who they're employing. You know, is everybody look the same? Are they all burned out and frustrated? You know, are there other women? Are there other men? Are there people of color? You know, do they have badge reels that indicate LGBT? You know what I mean? Like, what are the sort of things that would make you feel like this was a place to feel comfortable in? And if they don't offer that, or the other problem is, of course, if you're out of state, you know, as a new grad, it's really hard to argue that they should pay to fly you out to interview for a spot. If you were coming as a subspecialty PA, that definitely happens. Like neurosurgical PAs or people that have a really significant skill set, they will absolutely pay or at least cover some of the costs of you coming to interview in person. Or they'll give you like $100, you know, to pay for like a hotel room, but they won't pay for travel or something like that. But in any way possible, I would try to arrange an in-person portion of the interview. You had a second question?
Yes. Thank you for answering that too. All of my interviews were virtual, which I was not expecting, and I'm like local too, so it was kind of surprising for me. So my second question, another thing that came up that I was like not sure how to navigate during my interviews was that like almost I was applying for emergency medicine jobs, and in the area that I'm in, there's of course like a limited number and they all know who each other are. So when I was doing these interviews, they were specifically asking me like, oh, did you apply to this company? Like, have you gotten offers from other companies? And I was like, oh my God, like, how do I answer that? It was kind of a stressful thing of like, do I tell them? Do I tell them I have other offers? Do I tell them I haven't interviewed yet or I haven't heard, you know, like, how would you navigate that?
I absolutely say that I have other interviews. I want to be desirable. You know, I would never, ever disclose how much they were offering me. Now, at the same time, you can, if you are renegotiating a contract, you can absolutely say they offered me more, or they offered me fewer hours, or they had a better contract. You can say that at that point. But from an interview perspective, I would not get into the nuts and bolts of an actual contract negotiation. But I think it's totally appropriate to say, yeah, they expect you to be interviewing at other places. Now, the spin is, I've interviewed at those other places, but I haven't felt as comfortable as I have here. Or I haven't felt that I could be my best self as I'm hearing the way you're set up, or I really like how you onboard, or, you know what I mean? Suck up, you know what I mean? And you can use that as a comparison. And I'm sure if you Google, you can also find out all the scuttlebutt, because nobody raves about their company. They always throw their company under the bus, and people know that that's their reputation. So you can also say like, obviously I wouldn't say like your reputation online is terrible, but you can say certain things like, you know, contrary to what I've heard, or, you know, based on what I've seen and I've experienced, I really feel like this would be the best fit for me and where I am in my career, or where I want to grow my career. And I'm also a big fan of, you know, saying, I really like that you offer these leadership opportunities, or I feel like you would be able to support me better in some out of the exam room sort of endeavors that I'm hoping to pursue. And that shows again that you're a different candidate than a punch clock candidate, you know, somebody that just punches in and punches out. Is you're saying, and that's those questions that you ask. Is there going to be opportunities for me to be engaged in hospital-wide committees? Will you support me if I continue to be involved in state and national organizations? You know, I anticipate after I've sufficiently onboarded that I'm going to want to sort of re-engage with some of these other aspects, which is part of the reason why I think I make a good candidate, and I'd like to continue that involvement. How will that work? How, you know, will I be able to have some flexibility in my scheduling? I understand if you can't necessarily pay for me to go, but at the same time, if I go to certain things, do I need your permission to say that I work for you as a company? Because I've asked that before, to say, I'm not going to stop giving presentations, but I'm also not going to ask your permission every time that I do that. But you notice I didn't say which companies I work for. You know, could I? Sure. They have not said that I can't, but I choose not to because I don't want to blur that line. If you ask me, I'm happy to tell you, but I don't put that in any part of my presentations. Now, when you look, like when I presented AAPA, it lists my employers because I'm required to do that, but I don't put, like, I don't have the slide deck with them as a background or anything. I told them if they wanted me to do that, they'd have to pay for me to go to the conference. That's my trade-off. If they want the free advertising, then they need to pay for it. But then the issue is, then they want to authorize, they want to review what I'm going to say, and I'm not interested in that. So yeah, you can play a little hardball. It's okay. Other questions?
So on the contrary to the,
Oh, sorry, go ahead, Kayla, go ahead.
So if the truth is that you actually have not had any other interviews, I mean, do you say that honestly, or I mean, you don't want to lie?
Yeah, so I wouldn't say that you haven't had it. What I would say is I'm still early in my application process.
Oh, I like that. That's very well reworded.
Yep. Or you were my first choice.
Only choice. Yeah, first choice.
Minor details, but you're my first choice.
At this point, you're my first choice. Yeah. That sounds nice, and sounds like, you know, promising.
Right.
Yeah. My other question real quick is, with the, like, the pending licensure, while you're actually like working, you're seeing patients, you're, you know, hands-on and everything, but just not signing notes. Is that typically paid at any kind of like rate?
Yeah. So, and that's part of that onboarding question is, and this is where you can have, so when I first started in family practice in Pennsylvania, they had this PA grad sort of thing where basically you were like a student, but not a student, blah, blah, blah. And the tricky part is that I had to be under the practice as malpractice. Like, I'm still have to be covered, but you know, it was this kind of gray zone where it was a student, but a not student. And so instead of giving me like a salary, they just paid me a flat rate per week. They're like, we'll give you $500 a week. We're not going to hold off taxes. We're not going to do anything, because we anticipate it'll be about a month, because I was taking my boards and then starting. And by the time it turned around results, they figured it would be about a month. Other places will pay you at just a very much reduced rate, like an MA rate or a scribe rate or something. It's not, you know, it's not a lot, but it still at least is a check-in versus a check-out, and it's negotiable. You know what I mean? Like, especially if it's something where if you're in an outpatient practice where you're going to be developing your own panel of patients, you can say, again, you can argue for that. Well, this will be a great opportunity for meet my future patients. And hopefully then once I've gotten to know them in this capacity, that they can then continue to be my patient, which, you know, creates good, you know, patient rapport and things like that. And you sell again the idea that you're creating these connections and are that way able to jump much quicker into actually seeing these patients.
Awesome. Thank you.
So Deanna, like when you said that they were paying you a flat out $500 per week, is this like from the last day of your last rotation, or is it after your official graduation day?
So the way when I went to school back in the day, we had rotations, and then we came back on campus for like 6 weeks of just basically, it was like board practice and some other classroom stuff and things like that. We graduated, and then I took my boards 2 weeks after graduation, I think. And so I went and worked for 2 weeks, took my boards, and then worked for another 2 weeks before my board scores came in. So it was a month of work, and they gave me, I think, $2,500 total for the month or something like that. And but it came out to about $500 a week. And they just said, we're willing. And that was the same as like you talk about a signing bonus or relocation bonus. They just said, instead of it just being a straight bonus, I was going to sort of work for it, but in this sort of reduced capacity. It was a private family practice. I don't know if bigger health systems would be willing to do it. Looking back, it was super awesome that they did, obviously. But it was an option that was available. And again, this is one of those things of, even if you're not the first PA they've hired, this shows that you're thinking about things outside of the box from those other PAs that they're talking to, that you're flexible in your thought process, you're looking at processes, you understand bigger pictures, and that speaks to your worth as a candidate. So even if they're like, oh, hell no, we're not going to do that, at least it shows that you're thinking of other alternatives and ways to sort of apply yourself to the program or to the work.
So, I've had an interview where they asked me when I can work on this temporary permit.
Mm-hmm.
So, but I'm not able to tell them the date. So do I give them the last day of my last rotation, or is it the date that the program submits for graduation? What day would you tell them?
You have to check with your state, because from my recollection, you have to have graduated your program to be in this temporary license capacity, and you have to have a date set for your boards. Like, you can't just say like, oh, I'm going to take my boards. There has to be like an end date basically for it. So I would check with your board of medicine in whatever state you're practicing in to be absolutely sure. I would not trust the practice to know that. And I will say that over and over again, the docs and the practice managers and the credentialing office, none of them understand the nuances of PAs, even less so than the nurses, because the nurse practitioners are usually under the board of nursing, and NPs just do their own jam a lot of times. But the PA nuances of all these ins and outs, just talk to the board of medicine. And what I would also say, I would email the board of medicine and ask them to email your response so that you have it in writing. And if you end up, and then sometimes depending, they like wait a week before they get back to you, call them, ask for their email address. You email them and say, just to make sure I have this right, please reply to the email. So again, that you have proof of that. I mean, even I've been doing this for 16 years or however long. And just even in the last year, I applied for a DC license. And the guy said, I'm waiting. It took me 8 months to get the license because it was taking so long. And I finally was like, sir, like, and he's like, well, I didn't get your proof of education. And I was like, I can email you the receipt. And then they finally were like, oh, well, you've actually had your license active for 3 months. And I was like, that's cool. Thanks for letting me know. So I put into the hospital, and the hospital's like, well, we don't see this proof. And I'm like, this is the email that I got. And they're like, okay, that's good enough. And it was just based on an email, which seems to me kind of shady, but always have it in writing. Don't just go by a phone conversation. So if you have the phone conversation, ask to email them directly and ask them to reply to the email just to protect you. Mm-hmm. Other questions?
So we're getting, well, it's basically 7 o'clock or 8 o'clock Eastern time. So I was going to say, if you don't mind typing your email address into the chat so that if anybody else has questions, they can email you directly. And then we'll make your slides available to everybody too. And then we'll try to post this recording. So let me stop the recording if I can figure out how to do that.